When you are newly diagnosed with diabetes, your blood glucose levels may be higher than the target range your team has set for you. This is because your body needs to get used to the insulin, and it can take time to see how your body responds. Your team will be working hard with you to look at your glucose results, especially over the next few days, and adjust your insulin doses as needed. When your glucose level is too high, you will need to give an extra dose of fast-acting insulin to bring this down. This is called a correction dose. Your team will tell you what your target is and what your correction dose will be. Your correction dose, for example, may be written as 1 unit for every 5 millimole. This means 1 unit of fast-acting insulin will reduce your glucose level down by 5 millimoles. So, if your blood glucose level is 16 millimoles and we gave you 1 unit, this will reduce your glucose down to 11 millimoles. This is still too high. If we gave 2 units, this will bring your glucose down to 6 millimoles, which is within your target range. A correction dose is often given at a mealtime when you are routinely checking your glucose levels and will be added to the dose you will be given for your food. However, it can also be given separately between meals and before bed to bring your glucose levels down into the target range. Your team will explain to you when to give correction doses. In a previous session, we mentioned how fast-acting insulin works really hard for 2 hours, but will continue to keep on working for up to 4 hours. Therefore, if your correction dose is working properly, your glucose level should come down to the target 2 hours after this has been given. This also means that when doing a correction dose, you need to consider when you last gave an injection of fast-acting insulin. This is to ensure it is not given too close to a previous injection when insulin is still working hard to bring down your glucose level. Otherwise, this can cause a hypo. Over the first few days, you may find you are giving lots of corrections as your glucose levels may continue to be high. A high glucose level is a bit like a fire burning, and a correction dose can help to put out the fire. As you work with your team and your doses are adjusted, you should find you will need to give less correction doses. However, if you find you are doing lots of firefighting, then you need to try to prevent the fire from starting in the first place. For example, we need to find out the reason why your glucose levels are high. At this point, it is important to contact your team as your doses may need increasing again. As you grow, changes to your body may mean insulin does not work as well as it did before, and you will need more insulin to bring your glucose down into your target range. As a result, you and your team will need to regularly review your correction doses. If you are unwell, then please look at the sick day rules session again.